Okay. So we are live, and yes, there are attendees coming. So thank you for joining. We'll just wait another couple of minutes to allow attendees to join, and then we'll get started. Mm-hmm. Okay. Thank you for joining us. I think we'll start. We have few speakers, so I don't want to take too much time. This webinar is going to be recorded and will be available on the Hack4Rare agenda webinars page as offline on demand. So I just want to share my screen for a sec and introduce the Hack4Rare hackathon that we started in collaboration with MIT Hacking Medicine. So first of all, my name is Salvo La Rosa. I'm the Chief Scientific Officer for the Children's Tumor Foundation. And it's my pleasure to welcome you to today's webinar. As I said, the Hack4Rare is a virtual hackathon that is going to kick off on June 25th. And is going to last for about 5 weeks. You can reach out the website at hack4rare.org. You can register from here and also join the Slack channel. So if you haven't done so, please do. For the first time, we are expanding the hackathon from last year only NF to rhasopathies, PTEN Amartoma tumor syndrome, and also desmoid tumor with a single patient. Analysis done by research to the people. We're going to have prizes for different tracks. So the PTEN, the rhasopathies, and the NF track will have prizes, but also there will be opportunities for incubation prize for those that wants to develop their project even further. So for information on the different tracks, you can check the links down here. And for incubations, you can find more information about the Rare Incubator. And I will explain this also, in our future and next week webinars. So just a shout out to our sponsors and data contributors. This is an ongoing list. So far we have Bushi, Helix, AstraZeneca, the just newly come in Boston Children's Brain Tumor Network, and Children's Hospital of Philadelphia, the Center for Data-Driven Discovery in Biomedicine. We also have DNA Nexus, Sage Bionetwork, Varsun, Resi, Conference Series, but also the NF Open Science Initiative, the Data Portal, and our Registry, and also some of our community partners that are helping spread the words and contributing also with data. So thank you to all, and there will be more coming. So if you haven't registered, or if you want to have an update, we have already 200 people that have registered for the hackathon from all over the world, really. So this number is growing every day, and we hope to hit 250 participants by the time that we kick off on the 25th. Very few steps in order for you to register. If you haven't done so, just click on this page. So back to today, we are at our third webinar here, June 15 for the PTEN Hamartoma. So it's my pleasure to introduce Suzanne Mcfarland, Oncology and Cancer Predisposition at CHOP, Christine Anthony, President of the PTEN Foundation, and Thomas Fraser, Chief Science Officer. Actually, sorry, I think this slide is not updated, but Tom, I don't know if this is your current title or is I remember right. I changed it.
No, that's right. That's right.
Okay, great. And then Dr. Joanne Geo, Assistant Professor, University of Singapore, that she couldn't join us today. So I will pass to Christine and your speakers. So thank you so much, and tell us everything about PTEN.
Awesome. Thank you, Salvatore, and thank you for inviting us to participate in this amazing event. We're certainly honored. Hi, everyone. I am Kristen Anthony, the president and founder of the PTEN Amartoma Tumor Syndrome Foundation. Our foundation was started in 2013. I'm very pleased with the remarkable progress that we've made in terms of bringing the community together. We now have 3 centers of excellence, and that is Children's Hospital of Philadelphia, the Cleveland Clinic, and Boston Children's Hospital. Also, we have the first patient-reported outcome registry, which is IRB approved. We relaunched this registry in August of 2013 and now have 300 participants enrolled, also remarkable. And we are in the process of, are actually waiting on review of our protocol for a biorepository that we hope to officially put out to the community soon. I will put my information, contact information for all of you in the chat. If you have questions throughout this event, or need detailed information that you can't get your hands on, please reach out to me directly. I'm happy to share at any time. I'll also put my cell phone number on there, and don't be shy about using that. I am honored that 2 of our top researchers and clinicians are on this call. Dr. Suzanne Mcfarland, who's over the Cancer Predisposition Clinic at Children's Hospital of Philadelphia, and Dr. Tom Fraser, who is famous in our community working with our patients with neurodevelopmental issues. He is the with John Carroll University and also scientific director for Autism Speaks. We'll start with Suzanne. She's going to talk a little bit about PTEN at a high level in her role at Children's of Philadelphia, and then we'll move to Tom and let him introduce himself. And then at the end, if you are on and have questions, we are happy to answer those questions. And also Tom and Suzanne, or maybe Suzanne for Denise, if you want to put contact information in the chat as well. Thank you all again for attending. And with that, Suzanne, I'll let you take over.
Thank you so much for having me. It's exciting to be here, and I'm really excited about this project. I have a couple of slides that I can share just to kind of talk very high level about PTEN and the manifestations we see in children. Just pull that up. And just important to know, we have a multidisciplinary clinic at CHOP here, and that's just because we know that in pediatrics, there are so many different specialties that patients need to see. And I often just say to families that, no 2 children with PTEN Amartoma tumor syndrome are alike, even if they have the same mutation, they're from the same family. The manifestations can be really varied. And so that's why we really try to think about each patient as an individual and make sure they have all the specialists involved they need. And also why there are so many, big conundrums to solve with PTEN Amartoma tumor syndrome. Generally, patients come to us because of a diagnosis of macrocephaly and often also with a diagnosis of developmental delay or autism. The macrocephaly can be pronounced. It's usually 3 to 5 standard deviations above average is pretty predictive, but even a mild macrocephaly, we think about it. And then if you have the macrocephaly plus a diagnosis of either developmental delay or autism, we think about testing. And then there's some other kind of more syndromic findings like lipomas, penile freckling, signs of overgrowth, and a family history of disease, although I say a family history is not always predictive because a lot of patients are de novo, meaning that they have PTEN for the variants for the first time. When we think about the major things we see in patients, I know that Dr. Fraser will talk about this as well, but some of the main things that families are concerned about are the developmental and behavioral differences. About a quarter of patients have autism spectrum disorder diagnoses, but there are also a lot of individuals with non-ASD developmental delays, as well as other neuropsychiatric diagnoses, such as ADHD, anxiety, OCD, and other differences in adaptive functioning, sensory processing that can kind of sometimes get lumped in under that autism spectrum disorder diagnosis. But we really see, we involve a developmental pediatrician for our patients in our clinic because we think it's really important that all patients with PTEN get that evaluation. The thyroid involvement is another really big one for children, and is often one that can be a stressor and one that we're really trying to understand better because of the the way that the knockdown of the PTEN gene works. I often explain to families that it's one of those things that blocks overgrowth in your cells, and so most of the manifestations that we see in terms of tumors or growths have to do with just an overgrowth of a normal tissue in the place where it normally is. So a lot of them are going to be benign. But we worry about malignancy, and that's why we screen really closely. So for patients with PTEN hamartoma tumor syndrome, we'll often see involvement of the thyroid with nodules, and we have to watch that very closely. We start screening at the age of 7, but there's only a 5% risk of cancer under the age of 20. And so for children, we're often trying to make a decision between, should we be doing an early thyroidectomy because we're concerned about a nodule, or should we be watching it closely over time? And so we have a pediatric thyroid specialist that sees all of our patients and helps us to make those decisions, but it's not an easy one. And we try to really balance quality of life and making sure that the child can keep their thyroid as long as possible while still being careful about malignancy risk. So I'd say that's another big pediatric manifestation that can be a real struggle for families as we identify nodules and try to figure out if they're benign or malignant. We also see some neurologic manifestations. We see patients, I'd say the most frequent finding is hypotonia, but patients can also have differences on their MRI imaging. This is something that's certainly been clarified in some bigger studies of patients with PTEN differences, but the changes in MRI can be present in up to half of patients. We don't do routine screening with MRI because the risk of those findings actually being cancer is pretty low, but that is something that we often are talking about with families. And then another one that our clinic is investigating is the differences in immune function for patients with PTEN hamartoma tumor syndrome. I would say most patients have a normal immune function. They don't have frequent infections. They don't have any real manifestations. But we do, as we study this more, see subtle differences in patients. And then there's definitely an increase in things like autoimmune disease, lymphoid hyperplasia, like large tonsils and adenoids, and hypogammaglobulinemia. Hypogammaglobulinemia. And so we're trying to understand that better because we know that certainly for some patients, this can be very life-changing. And we don't really have instituted screening protocols for patients to make sure we're catching those individuals who would be at risk for decreased immune function. One of my areas of interest is also the polyposis that we see. In adults with PTEN, most of them are going to develop polyps and we start screening in the 30s, but we're finding more and more children actually have signs and symptoms of polyposis earlier on. And so we try to really have kind of a low threshold for evaluation for these patients. With these individuals, we can see all different polyp types. So it's not just the tubular adenomas that you think of in adults, but rather we can see juvenile polyps, serrated polyps, really all different types. And so this is also one of the reasons that these patients often end up coming to us for diagnosis, because if you see a child with multiple different types of GI polyps, you think about PTEN. And then I know that Denise could say a lot more about this, and she'll be taking over the mentoring role at CHOP going forward with this program. But vascular malformations are certainly one of the big manifestations that we can see in individuals with PTEN Amartoma tumor syndrome. She sees quite a few patients with quite a few differences in how their blood vessels are developing, and often we can start medication such as rapamycin to help with those. But through the complex vascular anomalies program here, she's been working hard to identify sort of pathways of inhibition to help treat those. And there's also, I mentioned some of the dermatologic features, but there's certainly a lot of other skin findings that can come with PTEN Amartoma tumor syndrome. So that's my quick, slightly over 5-minute review of what we're thinking about in children. You can certainly feel free to jump in with questions or ask anything, going forward. But happy to pass the baton to Dr. Fraser.
Thanks, Suzanne. That's great. I'm going to be brief, but I do want to share my screen just for a second. I imagine that the attendees are most interested in sort of how can we use our computer science, data science skills, those skills that you have to make a difference here. And so hopefully Suzanne and I can give you some ideas, but obviously maybe question and answer would be useful too. Let me just share my screen. I just have 3 slides I want to show you quickly. Over the last 7 years, we've learned a fair amount about PTEN, people with PTEN mutations, PHTS. And one of the things that we've learned is that there's a number of neurobehavioral or just sort of daily living behavioral domains, cognitive domains that do seem to be impacted, at least in subsets of patients. And so on this slide, you'll see the 2 rows of interest here are the one on the left, PTEN ASD, which is individuals with PTEN mutations who also have autism spectrum disorder. And then the one on the far right, which is individuals with PTEN mutations without autism spectrum disorder or any significant neurodevelopmental disability. And so the most interesting one here is really the far right column, because what you can see is that in many ways, behavior is average or even above average in these individuals with PTEN mutations without autism spectrum disorder. But there are still some areas that we see problems, including executive functioning, a little bit of working memory issues. So working memory is what we're conscious of in the moment. It's that ability to hold information in mind for a short period of time and operate on it. Executive functions are things like planning and organizing and sequencing information. And we also see significant difficulties with motor skills, and that goes along with the hypotonia that Dr. Mcfarland mentioned. And then we see some differences in sensory processing as well that go along with this. So even in individuals that do not have a significant neurodevelopmental disorder, we still see some neurobehavioral changes, difficulties that can impact daily functioning. Of course, in individuals with PTEN mutations with autism spectrum disorder, we see pretty significant neurobehavioral difficulties pretty much across the spectrum of different things, including things like processing speed, language, visual, spatial, motor, etc. So one way to think about this is that PTEN mutations in individuals with PHTS show a spectrum of neurobehavioral changes from individuals with no deficits who are really basically just functioning typically in the world, have very little to no psychiatric history, typically have average or above average cognitive abilities or IQ, developed fairly normally early in life, to individuals with more mild phenotype, meaning that they have some history maybe of developmental delays or just some mild frontal subcortical problems like executive functioning, planning, organizing, sequencing information. They may have some psychiatric history, but it's limited. Then we have individuals that are more moderately impacted. And these are individuals that typically will have autism or some other neurodevelopmental disability. They'd have more moderate difficulties with frontal systems in the brain. They also have lower or borderline cognitive abilities. And then we also have some individuals with PTEN mutations that have a more severe phenotype. And these individuals will have intellectual disability or global developmental delay. And they might also have autism or other neurodevelopmental problems. So one of the things we did recently that's relevant to this group, I think, is we surveyed a small group of individuals with PTEN mutations, PHTS patients, and we asked them sort of which areas are most important to you that we might cover in measures. And these are the areas that popped up here, these 13 areas. And on this slide, you can see motor, speech, daily living skills, executive functioning, quality of life, et cetera. You can read the slide, but we're in the process right now of building measures for each of these areas. And while this hackathon will not necessarily be able to utilize those measures, you know, one of the things I'd like people to think about is whether or not there's a way to build a platform where we could administer these kinds of assessments to patients so that they could collect this information for themselves to see sort of how their functioning is changing, but also maybe push that kind of information to physicians or psychologists like me in the future. So that's just an idea of one way in which this kind of effort could be used to improve quality of life and track symptom areas and neurobehavior for people with PHTS. But I will end there, and I'm happy to take questions as well. Was I supposed to pass it to anybody, Kristen?
No. And we're ending a little early with our presentation because Joanne is out sick today. I would echo what you said, Dr. Frazier, in terms of using those measures to rate quality of life for our patients and then being able to integrate that. We would like that for our registry, something that can not only take in the data, integrate that with our registry, but also analyze that information, maybe in different categories, neurodevelopmental or quality of life, for a patient that has a severe vascular anomaly. I think that would be absolutely amazing. And with that, Salvatore, I don't know if you want to chime in or if any of our
Thank you, Christine. Yeah, I think it's a very interesting, and of course, I think attendee can you know, chime in and just type your question if you want, or if you want to raise your hand. I have you here. I can unmute, and we can, you know, even we are a small group today, we can you know.
I see a chat. I see a Beth Stronach said these types of measures and instruments would be relevant and useful for RASopathies as well. Yeah, in fact, Beth, I'm not only working with PTEN, but I'm also working with 4 other rare genetic syndromes associated with neurodevelopment to develop these measures. So yes, I agree. They could be useful. I think for the hackathon, you know, and what Kristen was saying was maybe there's a way to, you know, we'll build the measures, but we don't have a way necessarily to offer these to patients and administer them and link them to the registry so that that information can be tracked and used over time by researchers. So that's, you know, maybe a starting place for something for this. Yeah, I'm happy to share. By the way, all the measures we develop, even though they're not developed yet, but all the measures we develop will be open source. So whatever is developed can be utilized for everybody. That was a condition of our development process.
So Thomas, is there any document that you can share about those measurements, or anything that would be useful to somehow create a questionnaire or a survey? I mean, which format are those measurements?
So let me just give you a little info about that. So I showed the 13 domains. So we expect that for each of those domains, we will be creating a scale, a survey scale for informants to rate. Could be a patient that's rating it, or it could be a caregiver or an informant. And what we expect to happen is for each of those 13 areas, the scale will be fairly brief. Let's say 8 to 10 items, okay? Some scales will be a little bit longer than that, but just for the sake of argument, let's say 8 to items for each of those areas. And so, one of the things we want to do with these sets of scales is not every scale is going to be relevant to every patient. Maybe you're a patient with PHTS and you don't have seizures, right? So you don't need to use the seizure scale. Or maybe you're a patient with PHTS and the biggest problem for you is motor difficulties. You just want to track that over time. So having a platform that allows a patient to select a different domain, and that domain populates that scale, and they can complete that scale on some kind of regular interval. And that information would also be linked back to the registry. I think that would be a really exciting advance for PHTS and for the PTEN Foundation that Kristen runs, because then researchers could access that data over time and say, we've got 100 patients now that have motor scales completed. Let's take a look and see what they're reporting over time. That would be kind of a cool thing. Does that kind of answer the question that you were asking, Salvatore?
Yes, and I know that there are various solutions now emerging in the mobile app or other computer apps that are allowing for tracking symptoms, but it's very difficult to like we did last year. We had a track for mobile engagement for patients, and there was a lot of, for instance, in NF is pain. We had a lot, how to track pain, but pain interference and understanding pain. But here is really there's a lot of things to be monitored. So that kind of administration of survey or scale and recording, I think is totally doable, first of all. And it's just a question of what is the priority, and maybe this setting of the hackathon can actually, develop one or two of those as a pilot and see how that work. So
and we already have
like
motor and anxiety. Yeah, sorry. We already have motor and anxiety scales if they wanted to just use those as a pilot example.
Yeah, and maybe some feedback from patients and, get some testing. And I think there is time to develop like almost, with your guidance or someone else's guidance, also, a working prototype for that kind of thing. I want just to shift back to, let's say, data available, especially for, all of the different, difference in phenotypes that are emerging in PTEN. Can you point us or, all of the participants to, data sets that they can use or, anything that could be relevant and what to compare with? Because, there's a lot of autism spectrum disorders. Is data on autism useful to understand, for instance, and compare, more like a large data set with this cohort of PTEN, and where to find this data, or what would be useful to compare with to understand maybe and make some, correlations.
Yeah, this is the unfortunate part, is we don't have a lot of data sets that are freely and easily accessed for this kind of stuff. There is a rare disease clinical research network, which theoretically offers data that they're collecting on PTEN, patients with PTEN mutations, as well as some other rare genetic syndromes associated with neurodevelopmental disabilities. But that data set is a little tough to access at this point because they're just getting started. I think if people wanted to, I think it depends on the kind of data that you want. Kristen, I know you're starting to develop a registry data set. I don't know how much sharing you have capacity yet with that. I have a small data set from Cleveland Clinic that I could share de-identified that would give some examples of, it's a very small data set of patients that we published in 2015 that would give some examples of the kinds of data that we collect from patients. But I think it really depends on the kind of data that they would want, people would want to have. And unfortunately, we're so new in PTEN that we don't have a lot of large open science data sets. Now, if somebody said, hey, I just want to play around with an autism data set and get that, well, then there are definitely some open source, or not open source, but close to open source autism data sets that people could play around with. In fact, I have one data set that is sort of autism and neurodevelopmental disabilities that I could get folks access to fairly quickly, that has some questionnaire data on autism symptoms across a large number of people, as well as some some other questions like, do they have seizures? Do they have motor difficulties? Do they have metabolic or mitochondrial difficulties? That kind of stuff, but very basic data. So that's one option too, but it would just depend on the use case for me.
Yeah, I guess my other question was, is how important, because I know PTEN, I mean, if you just, search PTEN is very, it's a very common mutation. So in terms of, other tumor types, how important is PTEN mutation in the somatic, as a somatic mutations more than, the germline side? And can we learn something that, other tumors, for instance, that are not, of course, Amartoma, that carry the PTEN mutations that are somehow related or correlated with PTEN? Because there's a vast literature. Can we use that PTEN, mutations in other, observed in other tumors and learn something for the specific subgroup of PTEN Amartoma?
I absolutely think so. I mean, I think that's just a huge area of interest is when we're learning about a germline change and how to target that germline change. Can that be applied to the cancers that involve PTEN variants, which, as you say, are very common somatically? I think that we can also do the reverse. We can think about how people are targeting PTEN in specific tumor types through whether it's through mTOR inhibition or other, and think about how we can apply that to the population that has a germline variant. So I think that this could work both ways. But I would say that the impact of this work certainly extends beyond germline carriers of PTEN variants to all individuals who have cancers with some kind of change in PTEN. Absolutely.
Yeah, and I guess there's a lot of still, ground that has not been covered here, especially in that, understanding how the mutation works. So there's a lot of, I think there's, I can point people to a specific data set, but, we have now a collaboration with Adam Resnick, and at CHOP is leading this huge consortium of data, and we are trying to get together like different data sets. But one data set I want to point people to is the Open PBTA that has been done by Alex Lemonade Stand. And this is a collection of 1,000 tumors, different regions. And, it could be, it's already like, organized. We'll provide a little bit more description, and I just want to drop it on the chat, which is here. We'll give a little bit more details, but it's a collection of 1,000 different tumors with RNA-seq, whole genome sequencing, and other. And I'm sure there are some PTEN mutations there, pretty sure. But that could be, a training set, right? So where people can, flex their algorithms and see if they can find anything useful, as this is well organized and annotated data sets. But there are a lot of other things that you can find on other public data sets.
Right. And Salvatore, we have about half of our participants within the registry have completed all surveys. And of those, we have 100% of their genetic reports. So we do have information that we can share in limited de-identified data sets for that. Also, there is a link on the PTEN track to our website, which has a number of PTEN publications, which are all fantastic. I mean, I think we have more than 30 there. With some really good information, and ClinVar as well has good information on PTEN, also listed on our track site.
So question from Beth again, how relevant or prevalent is the PTEN Amartoma syndrome? How many people do you have in your registry?
Our registry is newer. We already have 300 participants, and this is in less than a year. Representing 21 countries.
So impressive, Kristen.
Right.
It's a very rare disease. That's incredible.
I know, right. And what we're finding, more and more people are being diagnosed, and it's family sets where grandmother didn't know she had the mutation and then passed it to her child, and then they passed it on. This is becoming more prevalent Of course, like many rare diseases, it's listed as 1 in 200,000. We believe that's significantly underdiagnosed. Hopefully that answers the question.
Awesome. Can I suggest one thing? I want to share my screen and go to the PTEN track page. I'm sorry. Can you see? Wait a second.
Yes, we can see it.
Gonna do it again. Screen 2. Okay. So I hope you can actually read my screen. I'm zooming in. And maybe with this group and the help of Tom and Suzanne and you, Christine, we can, of course, we have, general pain points that we, kind of point our participants to how we can incentivize data sharing in rare disease in specific fields. How can we track quality of life in patients, collecting, real world data or real world evidence. This is, a general, really important now because patient gathered data, including home use settings, are still missing. So, and we need reliable way to do that, but also how we gather data from other sources and what are those other sources that can inform on health status. Now there is a lot of fancy on tracking apps and smart watches and all of this data. Is that relevant? And there are also specific studies and app that are very important, especially for Huntington disease or Parkinson, where they can measure tremor. You can things that are actually easy to track with this device.
And
but
Salvatore,
yeah, go ahead.
Just quickly, I just want to mention that we have a psychosocial quality of life measure that's freely available, and I'm happy to give it to anybody who's interested in doing something around that as well.
Awesome. So, and again, how can we help patients navigate information? This is another very important, information, especially for cognitive impaired patients. How can we point them to what they're really looking for, and sometimes, help them to find the right information, the right doctor. But then we can go back on specific track points, and maybe we can talk about this a little bit more in details. Like the idea to develop an easy to use patient facing tool, the way that we were talking, especially for this type of application that Tom pointed about, linking to the existing registry and regularly track on the list of points that you actually showed us. So, and here the opportunity is to work with a focus group of patients that will give some feedback, and also limited data sets available, for instance, to understand how to link how the registry is structured with the survey and the data that is collecting, and how this app will basically link to it and help to collect all of this data point. Anything that you guys want to add on this point? And I think it was clear anyway, Tom. How can we improve on challenging communication? And here, really understanding how PTEN mutations, what are those modifier genes that give you a more profound or less profound autism spectrum disorder, and create those different phenotypes in patients. So this is a very, very common type of analysis that it can be run for many different rare disease. I think every rare disease has genetic modifiers that needs to be understood. So if you already are conducting some kind of analysis on modifier genes for other rare conditions, maybe you can find and apply this to PTEN or other rhosopathies or neurofibromatosis. We're also very interested. But feel free to chime in at any point, Tom and Suzanne or Christine. And then, of course, identify drug and targets for PTEN are really links into what we discuss about, understanding the PTEN mutations at germline or somatic level, and see if we can identify something from targets. I don't know, maybe there are cell lines that are created for, with PTEN mutations, or, specifically for PTEN. Anything in that area that will leverage on what has been done. And I don't know if there are like landmark studies that can be maybe highlighted later to the participants where, you know, there is some biology that, you know, can be exploited, you know, from and data sets that can be exploited there. And then the other is create analytical tools. Sometimes it's difficult to exactly what we're trying to do in this hackathon, gather all of the data that is out there. And sometimes, you know, creating those tools and gather that data is the work that is essential for other people to go and, you know, work with it. So even, you know, gathering this data and making a search and a study that collects all of the relevant data sets could be a very good starting point to create that kind of library. So I don't know, this is the way I see this 4 specific pain points and ideas to work on specific PTEN.
Salvatore, I think a question came up and I don't see it. Do you see it on your end in the Q&A or the chat?
Oh, wait a second.
Panelist.
Let me see.
Or a participant, sorry.
It was a pop-up on Salvatore's email or something.
Oh, I see. Oh, sorry. I think it was on my, yes, it was on my.
It's relevant to us because they were just asking, are there references or tools that we could give? So we can, Kristen, I think we could send references like you said.
Yes, here there's a question from watching the webinar. I was wondering where the resources of the panelists mentioned. Are they on the Hack4Rare website? Basically, what we can do, what I suggest to do is after this webinar that, you know, Tom, you can send it to me and I will make sure that I'll put it on the PTEN track and page so that, you know, there are like all of the resources. So basically this same track that we are looking at now, there are resources. So there is information. There is also, you know, different searches that you can do for CleanVar, and under this tab we'll add also anything that will be useful after today. So if you can send it to me, all of the links or, you know, documents, we can share them there.
Dr. Mcfarland, can you think of other resources that maybe we've missed or open source information that we can share here?
Really, the other one I was thinking about is I know you said that CHOP's D3B program was participating, and I know that they've got a big sequencing effort going, both for the thyroid and the vascular malformation. So in the point of thinking about targeted therapies, I know that Dr. Adams will be involved going forward and thinking about targeted therapies for patients with either thyroid malignancies or vascular malformations would certainly be incredibly helpful for patients, but also that sequencing data should be accessible through this program.
Yeah, I'm sure, and maybe we can quickly connect with Adam and make sure that we create those resources or point participants to those.
Yeah,
resources.
Definitely. Let me know if I can be helpful about that.
Yeah, that will come soon. So I think my message here is to go back often to the PTEN track and the other tracks as well, as we'll post more information, hopefully before we start, you know, on June 25th. Everything is very close now. I mean, we're very close to the starting date. So hopefully we'll have all of those resources available.
Is there anyone that has any more questions? Don't be shy.
Okay. Okay, if there are no other questions, I think we can close it. We'll make this resource available, and we'll keep going and see what comes out from these projects. So as a reminder, each track has its own run, so you can participate in each track. Of course, those tracks that have less resources are more challenging, but there will be also, you know, a natural selection. So we hope you will take the challenge, the most difficult challenge as well. So thank you so much. I'll leave to you, Christine, for closure, and thank you, Tom, and thank you, Suzanne.
Yes, thank you, Tom, and Dr. Fraser and Dr. McFarland. And again, Salvo, thank you for inviting us to participate. Do not hesitate to reach out to any of us with the information in the chat, and we look forward to working with everyone going forward. Thank you.
Thanks,
Thank you.
everyone.
Bye-bye.